Our next guest is Dr. Joshua Gordon, the director of the National Institute of Mental Health, the lead federal agency for research on mental disorders. He oversees a research portfolio that seeks to transform the understanding and treatment of mental illness. I was able to catch up with him about his work just a short while ago. Take a listen.
Dr. Joshua Gordon, thanks for joining us today.
Pleasure to be here.
Well, tell us a little bit, as we start off this interview, tell us a little bit about your agency, NIMH, and its mission, briefly before we get into more questions, because I'm sure there are a lot of acronyms in Washington. What does your agency do?
The NIMH stands for the National Institute of Mental Health. We're the principal federal agency that supports and sponsors research into mental illness, and we're the largest funding agency for mental health research in the world.
Okay, now on the issue of mental health, we're still in the midst of a pandemic. How has that affected the field? More people seem to be talking about mental health because more people are facing more mental health challenges, certainly. But how has the field changed over the last couple of years?
Well, first of all, that increased interest in mental health and appreciation of mental health issues has resulted in greater interest in the part of the public in learning more about mental health research. And that's wonderful. It's also resulted in an increased appreciation for the need for evidence-based approaches to treat mental illness. And so we find that our scientists are busier than ever trying to explain and translate their findings into real-world benefit. And I would say also it's brought more people into mental health research who work on the cutting edge of translating treatments into public health action. That's been a real benefit for us.
The brain is such a complicated organ, and we don't know so much about it. We're still learning about the brain. What do you think? You've been in this field a long time. What has worked over the long term, and where do we need to make changes to the system so more people can get the care they need?
Well, there's a few different things that have worked. We've made tremendous progress in understanding the brain, although we're still far short of using much of that to improve treatments. But already we're seeing the benefits, whether it be the approval of 2 new medications just a couple of years ago by the FDA based upon neuroscience results, or the new work showing that one can customize treatments, whether it be through deep brain stimulation or transcranial magnetic stimulation that are aimed at specific brain circuits. So a lot of progress. Now, what can we do now, though, with the knowledge that we have? Where we've seen some real gains is in the appreciation and understanding of things like coordinated specialty care and collaborative care. These are models where we know to get the best results for people with mental illnesses, we need to provide wraparound services. We need to integrate them into primary care settings so that everyone can get the kind of supports they need, whether it be medication, psychotherapy, groups, family care, and help with the jobs and living situations. We know that that has real benefits for people with serious mental illness, and more we're seeing adoption of those evidence-based approaches.
As far as the stigma of mental health, years ago, people wouldn't say that they talked to a counselor or they've sought help. That seems to have changed. Is that one of the positive developments of the pandemic? It seems like more and more people are saying, yes, I need help, I need to get it, or I'm getting help. And it's okay to say that.
I think so. I think the pandemic increased a trend that was already out there. Everybody from celebrities to your neighbors acknowledging and admitting their mental health challenges. And in the context of the pandemic, it was even more important because as rates of symptoms of depression, anxiety, substance use, alcohol use, as those all went up, more and more people ended up needing that help. And so it's really a one potential silver lining of the pandemic. There's still a lot of work to do, and not every community in the United States, not every social group, not every person feels open about it, but the trends are all in the right direction.
As you know, doctor, where you live really is a key indicator of what kind of healthcare you get. How can policymakers and agency heads really solve the situation of disparities of whether it's service or reaching out to rural areas, which usually don't have the most doctors or the best doctors, as well as to minorities who are suffering from mental health disease?
Well, frankly, we need more research in these areas. We need to understand better how to reach underserved communities, be they rural, minorities, or other. And that's one thing that we're really focusing at in NIMH's research portfolio. But we do know some things that work. For geographically disparate populations, rural areas, et cetera, we know that telepsychiatry can be an effective means of delivering care. We know that for certain minorities and ethnic communities, providing treatment in settings where those individuals like it or prefer it can produce improvements. So, for example, in schools or in community centers, as opposed to in mental health clinics or hospitals. So we know some of how to reach these populations, but we don't know everything. We really need more research.
Telehealth has been an expanding, exploding practice. It was around obviously before the pandemic, but I think most people have had some type of telehealth visit over the last couple of years. Do you think that role of telehealth should be expanded as we hopefully eventually get out of the pandemic?
I think it's crucial that we use all the tools in our arsenal to reach everyone who needs help. And absolutely, telemental health is an evidence-based approach that can reach people and that can be effective when used appropriately.
What about the workforce? We have labor shortages in many industries right now. If you look at the demographics of this country, we're getting older, and there are not going to be enough workers, and specifically in healthcare. What should be done, and what is being done to help that, 10, 20 years down the road when most of the population in this country, or a good chunk of it, will be retired?
I think we do need to think carefully about our mental health workforce. We know we need to recruit more people into it. There are some evidence-based approaches that can help. For example, providing consultation services to primary care providers so that they can better utilize their own knowledge and help their patients with their mental health needs. But again, that's an area where we need greater research. I'll point out one other thing with an aging population. We need more psychiatrists who are skilled and trained in providing care for the elderly. We know there are many, many issues. Many elderly suffer from depression, from social isolation, from anxiety, and we really need more geriatric psychiatrists to care for them.
Just from an everyday perspective, just a normal person who's going through some mental health problems, what is your advice to those people?
Well, first and foremost, take care of yourself. There are a number of different ways to do that. Eating well, sleeping well, giving yourself a break from the stresses, whether they be work or family, so that you can take care of yourself. That's number one. Number two, reach out to those around you. Remember that social connections are some of the best buffers against stress and reduce risk for more significant mental health complications. So connecting with your friends, with your family around you, that can be very helpful. And the third is, if you find yourself unable to cope by yourself, do reach out to professionals. Talk with your doctor. Reach out to one of the many helplines that exist. 1-800-LifeNet is a good one to remember, and try to get the help that you need.
Dr. Josh Gordon, thanks for joining us on this important discussion today.
You're welcome. It's a pleasure to be here.